a large number of cases today and some other sort of worrisome signs as we kind of get deeper into the summer. So I'll turn it over right now for Dr. Byers to talk a little bit about the numbers.
Hey, good afternoon, everybody. Yeah, today we're going to be reporting out 957 newly reported cases. So that's on the high end of what we've reported out over the last several weeks. And we are now reporting out 44 deaths today. So this is a very large jump in the number of deaths. If you look at when these deaths have occurred, really 70+% of them have occurred between July 3rd and July 6th. So these are not deaths that occurred several weeks back. These are new deaths. 50% of them are among long-term care residents. Now, when we look at where our new cases are, we're seeing about 20% of them in the 18 to 29-year-old age group. But when you look at the age group between 18 and 59, which is on the younger side, that's where we're actually seeing our fastest growth in our cases, especially in that 18 to 29-year-old age group. But when you look at where the hospitalizations and the deaths are occurring, those are really 60 years of age and older. And so it's flipped. Cases over here in the younger group, fastest growing, but again, we're seeing the impact with hospitalizations and deaths on the older group. Our long-term care residents, we're still seeing a stable number of cases reported in them, but we expect that to change. We are seeing an increase in the number of long-term care outbreaks. If you remember, it hasn't been, but just several days ago when we reported that we were seeing 70 to 80 active ongoing long-term care outbreaks, we're up to 118 now. Again, those numbers are fluid and that changes from day to day as there are new outbreaks and some that resolve. But we're starting to again see an impact in the older population, in the most vulnerable population. We did anticipate this, unfortunately, with the big growth and big jump that we're seeing in our number of cases.
Thank you, Dr. Byers. I appreciate that update. Additional information, when we look at the hospitalizations, we're seeing increased number of hospitalizations and increasing stress on the health system. We currently have, yesterday, reported 624 COVID patients hospitalized in Mississippi, 167 in intensive care, and 93 on ventilators. But due to the low number and the lack of ICU capacity in certain markets, as we've sort of hinted in the past, we're going to have to move toward limiting elective procedures in certain areas. And so we will be releasing a public health order today that will restrict elective procedures such that in certain counties, hospitals cannot do elective procedures that lead to hospitalizations or elective medical admissions. And these counties are going to be Hinds County, Rankin County, Madison County, Forest County, Jones County, and Washington County. This also is going to be a fluid situation where we'll probably have to add additional counties as this continues to expand. Not only are we seeing it numerically, but we're getting reports and complaints on a regular basis about people unable to get care because there's nowhere to send patients once they show up in the emergency room. So again, Hinds, Rankin, Madison, Forest, Jones, and Washington County. I know that another thing that y'all are interested in probably is the outbreak among legislators and then staff members at the state capitol. We have 8 confirmed cases among the legislators and an additional 11 suspects who we believe the vast majority of them will end up being validated as positive cases. Yesterday we did test 270 people, including staff members and others around the Capitol complex. Those results are still outstanding, but we should have that information back this evening. And then the last thing I want to say is just as we kind of go into this, we do want to make a little bit stronger recommendations about how people can maintain safety. One of them is obviously the 6 feet separation when you're out and about, wearing a mask when you're in public, and also stay home. Not only don't go to small groups, but don't anything but small groups, but stay home as much as you can. The coronavirus is the worst that it's been in this whole time. We're seeing a massive number of new cases, and I just challenge you to call any of your primary care docs or urgent care clinics and say, hey, what are you seeing? They are just overburdened with people showing up getting coronavirus tests. So please be safe at this time when we're seeing so many cases out in the community. The last thing I'd like to say is certainly we're excited to see different communities embracing a mask ordinance and trying to embrace social distancing more aggressively, and would encourage every community, every city, every county to look at enacting a mask ordinance such that we can protect our citizens as much as possible. And that's all I have. Thank you very much.
Dr. Byers, do you have anything else you want to add?
No.
Okay, so Therese?
So first of all, when you said that half of the number of deaths today are from the long-term care facilities, how do we, at this point, I realize that's a widespread thing, but how do we protect those people now that we are in the worst phase of the coronavirus so far?
Yeah, go ahead, Dr. Byers.
Well, and the best way to do that is obviously to keep coronavirus from coming into the facility in the first place. And long-term care facilities have put in place a number of measures to try to limit transmission. But, it's dicey and it's concerning. And, it's been one of those things that's been very difficult to keep out of the long-term care facilities. We anticipate as we increase the transmission in the community, and remember that the employees who work at these facilities, they're out in the community. And, transmission can occur there. And so, screening of the employees and the staff members is vital. And once an infected staff member or employee is identified, they need to be excluded from work. We work with each of the facilities that have a new outbreak. We recommend testing, and a lot of times we're able to support that testing and help them test all of the residents, test all of the employees, so we can identify those folks who need to be excluded, identify those residents who need to be isolated, so that even if it does get in the facility, we can interrupt transmission and we can limit the impact, and that's the goal.
Go ahead, Ross.
Doc, you say you have 8 confirmed cases among legislators and staff folks at the state capitol. Does that include House Speaker Gunn and Representative Bo Brown, who both testified this last week?
Yeah, it includes the people that you're aware of already, yes.
And should the 11 suspects, you believe those will be confirmed as COVID also?
The vast majority of them, yes, sir.
Are those all lawmakers?
The majority of them, yes, sir.
And what is the condition of some of these folks? Or are some of these folks going to have to be hospitalized?
We wouldn't comment on any individual person's state of illness, but I will say that of all the ones that we're familiar with, they do have symptoms of some degree.
So could either of you elaborate? 957 new cases, I believe you said. Can you say again what time frame do you believe those came from? And we just had the 4th of July weekend, so what's causing the big spike? What's the leading causes?
So, when we look at where the transmission is occurring and how it's occurring, it's basically what we've talked about before. It's not necessarily associated with any large particular outbreak in an industry setting. It is person-to-person, widespread community transmission, and that's what we're seeing. Anytime group activities occur, we anticipate that we'll see an increase. After Memorial Day, we started seeing some increases in our number of cases. We may be seeing the same thing after the 4th of July. We heard anecdotally of a number of gatherings, large get-togethers where people are getting together and socializing and not social distancing and not wearing a mask. We can't continue to be surprised that when folks get into groups and they're not social distancing and they're not wearing a mask, that we're going to see a bump in cases. And, the time frame that these cases occur, remember there can sometimes be a lag in that reporting. Sometimes these folks may be symptomatic for a few days before they actually go to the doctor and get tested. And so it's best to look at our epi curve, and we put that on our website. And what you can see with that is that we're starting to trend up. But when you look at the 2 weeks past from today, we anticipate that we're going to fill that in more with additional cases as we move forward.
And do your studies at all found any evidence that these could have been linked to police brutality protests, or was it something different in gatherings?
We have not seen any large outbreaks or a number of cases at this point related to protests.
Anyone? Justin?
Yeah, I just wanted to kind of expand on the 44 deaths. Is that a number y'all expect to see, given the total number of cases? What appears to be, we're spreading from a lot of it's being transmitted from a younger population, maybe to an older one. So I guess that would mean there's a couple weeks there between those cases returning. Do you expect to see more of that in the future?
Yeah, I mean, that's something we've been saying the whole time. Like, it's not going to stay in kids, right? It's going to move up the age ladder, and that's kind of what we're seeing. The other thing about protecting nursing homes and stuff, these are not impermeable buildings where people don't come and go. The best way to protect everybody is for people not to get it in the first place. And it's just dangerous to violate the social distancing rules, which people are doing. And I know one of the things that happened, and we're looking into it, is a lot of these get-togethers on the sandbars over the 4th of July, and there was one that we were notified of that was right near Lakeland, and it's a bunch of teenagers. And we've got a bunch of listing of people that we think may be infected from that event, so we're looking into that. But again, it's just not surprising. You can't put a lot of people together in the middle of the worst pandemic in a century and expect nothing bad to happen. It's just absolutely insane thought process.
So let's take a couple questions. WLOX has 3 questions. We'll take a few of them now. 24 states are now requiring face masks in public. In Mississippi, casino workers and patrons must wear face masks. Most businesses require workers to use face coverings. Cities are starting to require them in public buildings. At what point, Dr. Dobbs, in terms of positive case numbers and trends, would you recommend the governor issue a statewide mandate on the wearing of masks?
That's been a pretty tough one, and certainly, obviously, we in public health have been advocating for face masks forever. We advocate for, at whatever level of government, that it be made a priority and then and even made a rule. So we support face masks. And wherever we can find success. Certainly, I've been on the road a lot, going county to county, kind of preaching the need for it. So we'll advocate for it, and I think as much as we can get folks to do it through whatever mechanism possible, and hopefully now that we're seeing this increase and we're seeing political leaders up and down the spectrum start to embrace it more aggressively, maybe we can have the broader populace accept it.
Okay, looking at hospitals in the state, what are your greatest concerns regarding COVID hospitalizations and ICU bed use in the mission to protect hospital resources? We've talked about that, but why don't you elaborate on that a little bit?
My greatest fear is starting to be realized because there are people in ERs now across the state who can't get a bed. They can't get transferred where they need to go. We're sending them out of state. It's not universal, but especially in the Jackson market we've talked about, it's always very tight. And I get calls every day from CEOs, from doctors who can't get their patients taken care of. So that is our fear, is that people who have COVID or other medical problems are not going to get the care they need. And we're at the point where that's happening, and that's why we're taking this step. Certainly we've done it with a lot of communications with physicians and hospitals so that they understand that it's coming, and try to do it in a way that's minimally disruptive but also maybe optimally effective.
So, and I'll take one more from WLOX. And we get a lot of this, Dr. Dobbs, on our website too. What is a business's responsibility to fully inform workers if an employee shows symptoms or tests positive regarding telling all other workers and doing contact tracing to determine who or whether fellow workers or customers of the person that he interacted with, he or she?
Well, the first thing I'm going to say is every one of us has encountered somebody with coronavirus. A lot of it's going to be, we got to make sure that we understand that anybody could be contagious at any given time. And so it's incumbent upon us to be on the preventive side instead of the punitive backside. So first and foremost, everybody, employers, individuals, everybody needs to take ownership of, yes, I'm at risk no matter what, no matter any situation. And y'all have seen us always wearing masks because we see it every day, and we don't want to catch it from one another. As far as like, you know, the duty, I mean, that's really a public health responsibility. I don't know, Paul, if you want to say anything about that, but certainly in businesses, there are rules about 50%, you know, retail and that sort of thing. But there is a responsibility, and there are OSHA guidelines about how to do stuff. Yes, sir.
Yeah, and you know, certainly when we do investigations, we identify those individuals who are in close contact and, you know, recommend quarantine for them and certainly get the cases isolated. It does help if employers are willing to notify all of their employees proactively as well when there's been a case, because, you know, what you want to do is you want to get tested. You want to monitor for symptoms. But we really do need to act as if anybody at any time that we come in contact with may be infected. And we need to do the same with ourselves. We need to act as if we could infect somebody else. If we do that, if we social distance, if we wear a mask, we can cut down on the transmission. And, you know, we saw this in May and the early part of June when we were holding steady with our cases, but we are now skyrocketing. And, you know, we may be in for a rough summer and a rougher fall.
Dr. Dobbs?
Ross,
Given
and then
what
Perez.
Dr. Myers just said.
Yeah.
May get to the point where the governor will have to pull back on some of these openings. You're talking about the 50% capacity in businesses and restaurants. Could it get to that point where we'll have to pull back on some of those openings?
You know, similar to the countywide, I mean, the county-specific actions we're taking today with hospitals, that's a strategy that the governor and his team have been thought was appropriate, targeted, proportional. And so we continue to talk with the governor's office, and we do have some thoughts about where that might go in the near future.
Let me ask you, back to the Capitol, do you believe all those folks at the Capitol who were infected were in those close quarters inside the Capitol, a lot of them not wearing masks?
You know, any grouping of people where you're going to have a lot of people in close proximity for a long duration of time, it's a risky endeavor. It doesn't matter if it's a wedding, if it's a funeral, or, you know, whatever it is, it doesn't matter because the virus doesn't care how it gets around. Certainly, we know they were very busy doing some really important work over the past couple of weeks, but it's going to be risky, especially if people don't maintain that distancing and masks. And certainly, you know, if those things could have been better performed, it would have been, you know, obviously, I think people would agree that that would have been a better thing to do. And certainly, we'll just continue to promote that for the future as an example of how important that is.
Perez.
So I can imagine the Facebook comments I'm about to get for this, but we were talking earlier about people who think they have already had it, that before it came in, and now everybody's testing positive for antibodies. Some of them showed symptoms, some didn't. Should those people be reporting to you guys when they get that antibody test back that says?
We get those already, but it's such a small number of people, and we got a report from the Red Cross that 1.2% of the people they check have antibodies. It's a really small percentage of people. So there is no herd immunity coming. I mean, most people have not had it. And then every single person I've talked to who said they had a cold in February or whatever and they thought they had it has been negative.
Okay, and just one more question. So we talk about this, and as we've gone, we kind of talked about it day to day. This is as bad as it's gotten, you know, that kind of thing. Where do we come out the other side? Is there, I mean, I realize that's kind of a broad question, but.
The other side's going to be like next spring or next summer, you know. So we're just going to be riding it, and it's just going to be a matter of how much tolerance people have for how, you know, unless it happens to you or your family, people don't think it's real. But eventually it's going to be you or your family. And as it grows and gets more, it's going to be more and more personal. You know, it's just a matter of what we decide is worth it on what the balance is. And it could be pretty bad.
Go ahead.
Can you guys speak a little bit to testing capacity? I know about 2 months ago we were trying to get more folks to be tested. Now we're hearing nationally some states having testing issues. I know, Dr. Dobbs, we talked about Mountain Valley last week doing such a good job. They've told folks they've run out of tests. I guess that means swabs right now. Can you speak a little bit to where capacity is and if we're ready for the continuing need?
Well, and this is a national event, right? And so we've seen this before. Whenever there were big demands on the national resources, we've had tightness in the system. And so with Florida, big states like Florida and Texas really just getting overwhelmed with cases, the big national reference labs are getting way backed up. And so that's going to be a real issue. At the State Public Health Lab, we've been able to meet our mission, and our turnaround times are still good, unchanged. There's a lot of demand out there for people getting tests, so that's fantastic that people are seeking care. But there will be intrinsic delays because we are vulnerable to national trends as far as like resources. Like with PPE, right? What happened with the PPE when New York and New Jersey went south is all the PPE went somewhere else. Same thing with testing. The best thing to do is prevent. We're very reactive in this, unfortunately, and from a very personal basis, anybody who's willing to hear the message, hear the message. Be safe. Do the simple things. Stay at home when you can. This is the pandemic of the century. It's not going to be going on year after year. It's just going to, it's just going to go till it goes. And just be patient and try to be safe so that we can come out on the other side of it safely. Some people aren't hearing the message. I understand that. Some people are denying the message. Some people are actively combating the message. Those folks are going to be harder to reach, I think, until there's a personal story attached to it. But for everyone who's willing to listen, please listen. It's not getting better. It's getting worse. And it gets worse every day.
Okay, so Dr. Dobbs, we have a ton of questions online, and then when we finish, Alex, you'll be next, okay? But I've got to get some of these. Okay, this is from the Clarion Ledger. The number of reported COVID-19 cases at the Central Mississippi Correctional Facility has grown to 33, the most out of any MDOC facility. Would you consider this an outbreak? What are the particular challenges and risks of controlling the spread of COVID-19 in a prison, and what is the health department doing to respond?
We haven't been super involved in the DOC, MDOC. They've had a lot of their own response, and certainly we've been available to help them. We've done some other stuff. Corrections is a challenging situation because you have people who are in close proximity with shared air, and you have people coming in and out from employees. So it's going to continue to be a challenge, and certainly we're there to support them when they need us.
And certainly, correctional settings and prison settings, it's just like any other congregate residential setting, and it's more difficult to quarantine folks when they're in very large pods and you have whole groups together. We have worked early on with Department of Corrections and providing them with guidance, and it is a challenge though, and it's a challenge in any sort of setting where you have people living together and have large congregate groups. There's a potential that there'll be transmission, and remember, that we deal with asymptomatic transmission, we deal with pre-symptomatic transmission, and before an individual is even infected, they can transmit the infection. So, before they are symptomatic, they can transmit the infection. So it's a tough situation everywhere when you have a situation like that, sure.
Okay, Dr. Dobbs, this is from Anita Lee at the Sun Herald. Why urge local mask mandates rather than statewide?
Well, it's the same thing as smoke-free air, right? Mm-hmm. We haven't been able to get smoke-free air in the state forever, but where we have partners on the local level who are willing to embrace it, we found a lot of success. So we're just about success. And wherever we can, where we can find local, and that's actually where there's a benefit to having local too, because if you get the local folks to buy in, they're the ones who are enforcing it anyway. So it is a strategy that's worked before in other public health campaigns, and I think it's something that we need to, we'll push it at every level, but it is an effective approach.
Okay, I don't really think do the 8 confirmed cases in the legislature include Lieutenant Governor Hosemann and Speaker Gunn? Have either one of them come out publicly? Speaker Gunn did come out, and he did a Facebook, and I think Bo Brown, you had mentioned before, those are within that number that we mentioned before. Okay. Nick Juden from the Jackson Free Press, and I think you talked about this. Which areas are you most concerned about? Which counties in terms of hospital capacity? I would assume those are the ones that you've already mentioned. They are, and certainly we're watching other ones too. This is a fluid situation. DeSoto is having a lot of cases. If we look at our hotspots around the state, we have Grenada
you know, and CDC actually called me this week and said, hey, you got some bad stuff going on in these areas, DeSoto, Grenada, Jackson area, Harrison County. We know it, we knew it, but you know, some of those areas have preserved hospital resources somewhat. We're going to watch it closely every day, and if we have to do anything, we will.
Dr. Byers, you look like you were, okay. This is from Mel Carlock with WTVA. Have any cases been tied to graduation ceremony in some schools held recently?
I'm aware of some in counties where they've had graduations, but none recently, but in May, but I don't know of any recently. But we're going to be in a sea of outbreaks, just honestly. I mean, it's basically we're just a whole state full of outbreaks everywhere. So people are going to know about stuff that we're not going to know about just because it's just ubiquitous. It's everywhere.
I mean, anytime that you get folks together, you're going to have, and all it takes is one individual to be infected. If you've got people in close proximity who are not social distancing, who are not wearing a mask, you're going to have some transmission. I mean, you know, that's going to occur repeatedly throughout the summer.
Okay. Health experts at UMC have been very clear there is no safe way to eat at a restaurant. Do you agree? Is the solution to return to takeout delivery only?
You know, that's a big conversation. I will say that we're dismayed to see people not following the rules. And if you go to a restaurant, sometimes they do a really good job and sometimes they don't. I'm personally leery of staying in a restaurant indoors. I have eaten outdoors on occasion. It's just just a matter of risk, and also going into restaurants where even if the staff is wearing masks. And I was at one restaurant in Jackson before the ordinance, and not a single patron out of a lot of patrons was wearing a mask. So it makes me uneasy, and I think that's part of a qualified. Can it be done safely? I do think it can be done safely. Is it being done safely? Sometimes, but not probably even in the majority of the times.
Do take one more, and then we'll go to Alex. This is from Stephen Gagliano. If this trend continues, do you believe schools will be able to operate in the fall?
They are looking at, and certainly we've been in communications with them, looking at options to safely educate kids, and we understand, and there's been a lot of, like the Pediatrics Association of Pediatricians understands the value of kids need to get educated, and we get that. We'll do everything we can to support safe education. This makes it harder, you know, that we seem to be willing to sacrifice nursing homes and schools to go to a party is absolutely phenomenal to me, just to be honest. It actually hurts my heart a little bit that we don't have enough patience to support those things that are critical to the success of our kids and our seniors. We'll continue to work to try to find the safest pathways possible, but it makes it harder and harder the deeper we get into this. Anything else, Dr. Byers?
No, I think you're right on it.
Dr. Dobbs, I'm sorry I couldn't keep up with you word for word when you first said this. Can you say again what public health order was listed for Hines, Rankin, Jones, Washington, Madison, and Forest? And so what exactly does that mean for the healthcare system? What's the seriousness behind that you want the public to know with why that order was necessary, meaning for the healthcare systems? You know, we're running out of ICU beds and we're running out of hospital beds in certain areas, and people aren't getting the care they need. It's happening now. This is not a future state. This is a now state. We're hoping that we're acting at a point where we can loosen up some availability without harming people's need to access care. And so in those counties, Hines, Rankin, Madison, Forest, Jones, and Washington, we're limiting elective surgeries, non-urgent surgeries, and hospitalizations that require overnight hospitalization. A lot of elective surgeries you can just do as an outpatient, get in and go at an ambulatory surgery center. That's all fine. But if it's a serious surgery that's an elective surgery that's going to require overnight hospitalization, then those will not be allowed for the time being in those areas. And that official order should be released shortly, I do believe, yes. So if someone needs an elective surgery, what does that mean? You had mentioned you're already taking patients out of state, is that correct? What does that mean for the next step? Well, patients go out of state for emergent medical care because they can't get a bed in a Mississippi hospital. That's horrible. But you know, for right now, we're going to hopefully this will loosen up some space, and we know hospitals are working to add capacity for those critical resources, and we're certainly excited to see their willingness to do that.
This is just starting, y'all. This is just the front, and we'll do. There's only so much that we can do as a health department. You know, when I'm upstairs, it's me, Dr. Byers, and one other doctor in the whole place, right? You know, it's not a whole lot of, you know, there's not clinical resources here. We're trying to give guidance and everything, but there's only so much the Department of Health can do. We all got to do something. The hospitals are going to be, they're working hard, but they're going to be at the front lines having to deal with this when they can't get their patients taken care of, and they're dealing with it now. So whatever we can do to support them, and some of this we're doing at the insistence of hospitals as well.
Ross?
Again, given what's happening today and the way the trend is going, it seems like it may be a matter of days and not weeks before you may have to recommend to the governor to take drastic action.
Yeah, we'll see. We'll do everything we can, and we have other things in the toolbox that we're looking at doing as far as like community-based interventions, but there's no amount of prudent planning that can overcome foolish behavior, and it may just be bad. There's no amount of anything we can do if people are going to act recklessly. So we'll mitigate as best we can, but you know, short of you know, this is not a Mississippi thing. This is an American thing. This is a Southeastern thing, and you know, we'll do everything we can do.
Erica?
How big of a role does hospital or ambulance diversion play into the 6 counties that we're limiting elective surgeries in?
You know, that's part of it, is, you know, that plays into it when hospitals go on diversion. They can't take ICU beds. That's all part and parcel of the equation. It's built into the bed availability that we monitor.
Do you know how often it's been happening?
Oh, a lot. I mean, it happens a lot anyway. The problem is now there's just nowhere to send them. Everybody can't be on diversion at the same time, but there's nowhere to go.
So one of the discussions that still is being had is, of course, whether or not masks are safe. Can you guys talk about whether or not masks are safe and the, you know?
Surgeons wear masks all day long. OR nurses wear masks all day long. I wear a mask all day long. You do not poison yourself with your own carbon dioxide. Someone asked me about your breathing your own carbon monoxide. If you bring your own carbon monoxide, then you're already dead, because we don't make carbon monoxide. Yes, it's not going to hurt you, but it is going to keep you, hopefully, from spreading or getting coronavirus.